what we've seen in Canterbury is unprecedented in terms of the pace and extent of the outbreak that we've seen. Sadly, we've seen 2 reported fatality. We've got a number of other suspected cases, and we've had 4 confirmed by the labs. Since Saturday night, we've been actively tracing the contacts in these cases, making sure that those who've come into close contact with suspected cases are given courses of antibiotics. The good news is antibiotics are extremely effective in 90% of cases. And so what we're now doing, as well as the work that's already been done to reach students at the University of Kent in Canterbury, to make sure that they're offered antibiotics, we're also standing up 4 centres in Canterbury today, and we're making sure that those who are concerned are able to access antibiotics. We'll also be, with UK Health Security Agency, beginning a targeted vaccination programme. That will be set out in the coming days, and we'll be looking at whether there should be additional cohorts in addition to students in halls of residences who will be beneficiaries of the first round of vaccination. Clearly, this is a fast-moving situation. My heart particularly goes out to the families of the 2 young people who've died. I cannot begin to imagine what they are going through. And working not just with the UK Health Security Agency and the NHS, but with schools and colleges and the universities in the area, we'll be working proactively to make sure that this is contained and that the risk to the general public is low.
Are you expecting the possibility of further deaths?
It's a fast-moving situation. It's too early to say what we'll see in terms of the numbers of people affected and the severity of the impact. But what we've already seen in recent days, in terms of the pace and the extent of the spread of this disease, is unprecedented. The UK Health Security Agency has responded fast in terms of contact tracing, making sure that those who've come into contact with people suspected of being infected, offering antibiotics, which are extremely effective in these cases, has been commendable. We're also working with schools. There are 3 schools where we think that there are students who may or have been affected, and we'll be working with other education settings across Canterbury too.
Do you have full confidence in the UK Health Security Agency? Some critics have said they've just moved too slowly on this.
Well, what we've seen in recent days is unprecedented in terms of the pace at which the disease has spread and the extent to which it's spread. And the UK Health Security Agency have acted fast from Saturday night, when they first became aware of 1 case, actively contact tracing in that case and every other that we've been made aware of in the days that have passed since. And through that effort, as well as the targeting of students on campus in halls of residence, we've stood up a rapid response, with including the distribution of antibiotics, which are highly effective. Now, of course, we will eventually reflect back on how we've done, but I just remind people that this is a fast-moving situation. We have sadly seen 2 young people tragically die. That's an awful situation for their families to be in. But the nature of this disease is that it spreads through close personal contact, things like kissing, sharing of vapes, sharing of drinks, shared household settings. So the general risk is much lower, but we are being proactive in terms of tracing contacts, proactive in terms of the availability of antibiotics. And today I've announced that we will also be standing up a targeted vaccination programme for students in halls of residence at the University of Kent initially, but we're actively looking at wider cohorts with UK Health Security Agency as the facts emerge.
Why was it not possible for teenagers to get a meningitis B vaccine before now? Isn't this just too little too late? Why was it not available earlier?
When it comes to vaccination campaigns generally, we rely on expert advice from the JCVI, which is an independent group of scientists who draw on the data and the evidence and provide advice to me and to my predecessors about which vaccines should be available to which cohorts. Clearly, in light of what we've seen in recent days, I am asking JCVI to revisit that advice to assure me and to assure the public that the advice is in the right place, and if it isn't, to provide us with fresh advice that we can then act upon.
So more possibility of it being rolled out more generally than that small group of students?
Well, I think there's two separate issues here. There's the targeted vaccination programme, which will be standing up for students in halls of residence at the University of Kent. We may well want to expand that vaccination programme to additional cohorts. As for general population vaccination, we rely on the expert advice of the JCVI, which is an independent group of scientists. And in light of what we've seen in Canterbury in recent days, I'm asking JCVI to look at this experience and to test this experience against the advice they've provided to me and my predecessors previously. And if the advice needs to change, we'll obviously act on it.
Finally, do you think this is containable? Is it something that can be prevented from spreading well beyond the area of Kent that it's now in?
Well, what we've seen in recent days is unprecedented in terms of the extent of transmission and the pace at which it's occurred. We've already sadly lost 2 young people, and I cannot begin to imagine what those families are going through. And my heart goes out to them. There'll be many more people who are worried besides, whether students or indeed their families. So I think there are a few things that people should be reassured by. The first is that the UK Health Security Agency has been proactively contact tracing in recent days from Saturday night onwards, from the moment we became aware of the first case. And through that, antibiotics have reached those people who've come into direct contact, and we've made antibiotics more widely, including through 4 new centres that have opened today. The second is that the antibiotics are really effective. One course is effective in 90% of cases. So that is good news for people who are worried they may have come into contact with the disease. And thirdly, we're standing up a targeted vaccination campaign, initially targeted at students at the University of Kent in halls of residence, but we are actively looking at whether other cohorts may also benefit. All of those things taken together, the contact tracing that's happened, the antibiotic distribution that's underway, the standing up of the vaccination campaign, and the wider public health messaging that's going out, including through the universities, local colleges and schools in the area, give me absolute confidence that this is containable, but we'll be working proactively and around the clock to make sure that we contain this as best we possibly can.
Secretary of State, thank you very much.
Thank you.
Thank you.
Thank you.
Okay.